What's your pain number? Is it a 1 or is it a 10? When you go to any medical office, that's the first question you get when dealing with pain. But your 2 may be somebody else's 5. There is no consensus. And this has been an issue that's heavily debated through pain medicine for decades. There are some tests called the Oswestry Disability Index and many others that have a questionnaire, 15 to 20 questions that try to capture the true essence of pain. The problem, it takes a long time. So in the end, we've settled with this 1 through 10 scoring of pain. And is it perfect? Not at all. It's just a guide for us to identify where you're at and how we treat you. And again, if you have diabetes, we know exactly what your number is with a little pinprick. If you have a blood pressure issue, a blood pressure cuff tells us exactly where you are. If you have a temperature, we know what number you have. But for pain, there isn't a device that tests your pain. So pain is a negative physical and emotional experience that you need to convey to a provider, and all we have are these 1 to 10 numbers, and that's why it's important to work with providers who understand that and work with you to get you to a place where you're functioning. When I talk to a patient who's in pain, I look at the number, but then what I ask them always is, are you happy where you're at? And some people say no, and they could be at a 2. Then I ask them what their goals are. And that's really the way I try to guide treatment. I had a 90-year-old lady today that came in and her pain was a 6. And I told her, are you happy with that? And she said she was. She had a pain that was a 9. I did an epidural. Her pain had reduced. And to her, a 6 was great. I had a 37-year-old patient whose pain was a 2. He was not happy. I asked him why. He said that when he went out and played soccer every single day, his pain shot up to a 9 or 10. So in that situation, the number didn't matter. His goals and his function and what he wanted to do was the issue we had to address. And that's how you use the numbers to guide you as a medical provider to get you a proper treatment plan. Thank you for watching, but remember, this is not specific medical advice to individuals out there. Always consult your physician before starting, stopping, or changing a treatment plan.